Good afternoon. We're ready to start with the last portion of our symposium. There's another round table with patient survivors, and we have the pleasure of having three of them. We're going to start with Nicole Branson. She's a young patient recently diagnosed with gastric cancer. She's gone through treatment already, and we're going to let her share with us and the participants her journey. Welcome, Nicole. We're excited to hear about your journey.
Thank you. Thanks so much for having me. So as I said, yep, I'm Nicole Branson. I am here coming to you from Arizona. I'm in Chandler, so just outside of Phoenix. So I was diagnosed last year, beginning of August. I was sick for most of the year last year. And then in July, I kind of went down for the count. So some of the symptoms that I had going into my diagnosis were I had severe swelling of my stomach, so a lot of distension. I kind of had started losing my appetite. I started to have an inability to be able to eat and drink, like even simple things like water would make me sick. And then I actually ended up having some severe acid reflux. I mean, to the point where I couldn't sleep in my own bed. I had to sleep out on the sofa. It got pretty bad. So by about the July 4th weekend last year, I couldn't do anything. I didn't want to eat. I was throwing up almost every time I put anything into my body. So I luckily was able to get in with a GI doctor. They got me in for an endo, found that I had a large mass in the base of my stomach. And that mass was actually covering my pyloric sphincter. And so that was the reason that I was throwing up and I wasn't able to really get anything into my body, and why the distension was. And actually, when he went in and did my endoscopy, he took out, I want to say, 2 liters worth, which is like 2 soda bottles worth of liquid that had been filled up in my stomach. So I had my diagnosis on August 2nd. They moved me really quickly through the process. So I had August 2nd was my diagnosis. I had already met with the oncologist and the surgeon. And then they had me in to get my port placement and diagnostic laparoscopy done. I think it was like the 5th. And then I was in for my first chemo on August 10th. So it was within a 2-week turnaround that they had me from diagnosis into my first chemo. So I did 4 rounds of float prior to my surgery. I went for surgery beginning of November last year. I did 25 rounds of radiation after the fact because of where the location was of the mass and the cancer. It was close to, I want to say duodenum. I'm really bad at pronunciation for some of these things, but because of the location, they were worried that he wanted to make sure that the margins were good down in the lower side of things. So I did 25 rounds of radiation December through into the beginning of January. And then I started my last 4 rounds of chemo February-ish, beginning of February. So I am actually celebrating 5 months of being done with cancer, with my chemo. So I did my last round of chemo on March 22nd. So I'm very happy to be feeling good and starting to kind of come back into my own energy and stuff like that. So for anybody that's just getting started, know that just make it through the process, stay positive, and just keep doing what you're doing, and you're gonna get there. So talking about support through all of this, I'd have to say my first primary support system was my family and friends. I had family. I was very blessed that my family made it a priority to come out for my chemo weeks. So my chemo sessions, we really didn't know what to expect moving into the cancer treatment and the chemo. But my first round of chemo, I will say, was, I don't want to say the most difficult, but it definitely was interesting. I knew after my first chemo session that it was working, because I was able to eat and drink again without having the fullness and the distension and the uncomfortability. And so I was able to start eating, which was great. I had lost a lot of weight because of the inability to eat and the vomiting and all that stuff. So but they made it out for chemo weeks, and if one of my set of family wasn't able to make it, then somebody else planned on being out here to help us. My boyfriend was working throughout the process, and we were blessed again that his work was allowing him to work from home the weeks I had my chemo treatments. So it was hard, but it was great because it was consistent throughout each of my treatments. I knew what to expect. I'd go in for my infusions, and then I knew that, a couple of days later, I'd be down for the count. I'd be in bed. I would have no appetite. It was very, very consistent, which sounds like it's pretty much the case for a lot of people. But family and friends were a big, big support for me. I'm one that I have a hard time asking for help. I'm somebody that I've always been self-dependent, relied on myself. And so this was something that I had to give up. I had to allow people to help me. And so when people asked me, what can we do for you? What do you need from us? I let them know, we ended up having friends come out and help us pull weeds in my front yard because, my boyfriend and I just couldn't get out and do it between the doctor's appointments, between him still having to work, between just feeling down and not, this was July and August in Phoenix. So, it's 110 degrees out. So going through chemotherapy and trying to get outside to, take care of yard work and maintenance and stuff just wasn't in the cards for me by any stretch of the imagination. I had a friend set up a GoFundMe page, which that was also really helpful. You're focused so much on the treatment and the care and feeling better, trying to feel better, and trying that anticipation of what's going on next. I didn't work fully throughout this. On my good weeks, I would do what I could for work. And when I was feeling up to it, I would. But I'm lucky that I work for myself, and so I'm able to make my own work schedule depending on what my clients' needs are. So, I worked where I could, but overall, for the most part, I didn't because I couldn't. I was just physically unable to. So I'd have to say those were my first two primary real good support systems were family and friends, and just learning that I could be okay doing that, so my biggest recommendation to people would be write down things that you need, whether or not it be just doing dishes, laundry. I didn't want to get out of bed to do laundry some days, or even to cook food for myself. My chemo weeks, we knew that I would have no appetite. I would have no I wouldn't know what I would have taste for. So my boyfriend knew that he would have to come up with meals, and even though I didn't feel like eating, he would have to help me make sure, like, hey, let's get out of bed, get off your butt. Let's go get something in you because you need the nutrition and you need to help fuel your body. Going into doctor's visits and stuff, we always made sure that somebody was with me throughout, the doctor's visits as well. An app that I would recommend for people, if you don't have somebody that can make it with you to a doctor's appointment, or even if you do have somebody that goes with you to a doctor appointment, because you don't always remember what they say. You don't always understand what the verbiage is and what they're calling things, and you want to maybe Google something later. There's an app called Otter that actually records conversations, and it will actually, you can do the playback and all that kind of stuff. It's a really, really cool app. So that's Otter. I'd say that was a good thing for me as well. Some other really good support things were Facebook groups. This was another thing that I really didn't think that I would take to. It was a family member of mine that actually recommended it to me. And she had sent me a few different Facebook groups, but actually that's where I became connected with Debbie's Dream Foundation, was because of some of the Facebook groups I was on. And I have to say they have been just a great resource for different things, as we talk about food and dietary needs and change in habits and all those types of things after you have your stomach removal or go through chemo, and doing all of these treatments and processes. They have some great meal demonstrations. They have chefs that come on, and they have a oncologist dietitian that is a part of these things that I found really, really useful for myself. In addition, they have like support groups, different mentors, and just different educational, just like today, the symposium, they have multiple symposiums that they do that I felt were really, really beneficial for me throughout the process. So I will give you a couple of the Facebook groups that I am a part of, but one's called Stomach Cancer Sisters. There's another Stomach Cancer Support Group. That's just the name of it. Stomach Cancer Warriors and Caregiver Family, and then Stomach Cancer Support, and then Dream Big Together. So those are some really good ones, to get on into. There's some really great support, people that are going through this. Family and friends are great because they want to be supportive in there, but sometimes there's just something about reaching out and talking to people that know what you're going through and are having the same feelings. I've made some really good friends and connections. And then when there are days that I'm not feeling well, I talk to somebody. I talk to one of the girls and I'm just like, hey, have you gone through this? If I'm having stomach aches or whatever, I guess they're not really stomach aches anymore since I don't have a stomach to really per se, but it's really good to find somebody that you can talk to, somebody that you can relate to, they can relate to you. I've started doing a little bit of mentorship and talking to individuals and helping with some of those things as well. And I think it's great for the person going through the process. And honestly, it's helped me like reevaluate and look back over the last year and God, oh my goodness, what have I gone through? It's just amazing. The connections and the friendships that you make with people are just, it's going to be forever with these people because you've gone through these things together. There's kind of going back to maybe some of the financial things of being sick. I didn't realize how much of an impact it would be there was an oncology social worker that I worked with at the beginning of my process. So I would highly recommend if your group that you're working with has a social worker, talk to them. Because again, you're focused so much on your health and well-being and trying to get through this process. Have that social worker there to help you with the financial side. We investigated different programs that were available to me. We ended up, I think, getting approved for it was a gift card for grocery stores. Somebody was donating gift cards. And I'll tell you, even that little bit, I can't remember exactly what the dollar amount was, but even that little bit on a monthly basis helped because when I was going to the grocery store, because I'm not bringing in income on a weekly basis or monthly basis or whatever it is, timeline wise, that was really, really helpful. Cleaning as well, keeping your house clean and that kind of stuff. There's a program that I found out about called Cleaning for a Reason. They actually send somebody out, and check your availability in your area, but they send somebody out and do 2 free cleanings, while you're on chemo and, just to keep your house clean. So there are a lot of different programs out there that are available that, I wouldn't have known about if it wasn't for working with the social worker. Don't forget to talk to your doctor. Being on some of these groups, your doctor is there for you, whether or not you find you think that you're being a pain or whatever, talk to them. If you feel like something's wrong, if you have a symptom that is different from the last time, call them, talk to them. Even so after my surgery, I was trying to figure out dietitian and nutritionists. I met with somebody in the hospital after my stomach was removed. So I had a partial gastrectomy. So I had 80% of my stomach removed as well as my gallbladder. And I met with a nutritionist while we were in the hospital. But then after that, I was like, okay, so who do I talk to? What do I do? And so, I talked to different people, but my oncologist actually referred me out to somebody that he works with on a full-time basis. So making sure that you go to the correct dietitian after and during, they talked about it today already, but making sure you're talking to that person, because we lose so much weight. I mean, I'm normally, or I have been about 130 to 135 pounds. And at the end of my chemo, at my lowest weight, I was 94 pounds. I have since built back. I think I'm at about 110, 111 pounds now. So I've gained back about 15, 16 pounds, and I've been able to keep that on, which is really, really great. But you really need the help to do it, because our bodies are going to be so different now from what they were before all of this, before surgery, before losing your stomach, all of that, that you really need somebody that is educated and knowledgeable, that can help you move forward. I also met with an integrative medical oncology. What is she? She was a medical director of supportive care. So also talking about, our nutrition. I became anemic because of all the stuff that I was on. And so my red blood cell count, my white blood cell count, all this stuff is low. So she started me on the correct items for, I'm on a liquid iron, I'm on a calcium, magnesium with some vitamin D3, all of these things to try to help improve, my function and all of that kind of stuff. So, again, talking to your doctor and having your oncologist or whoever it is that you're working with, your surgeon, guide you in the right direction of who you need to be seeing to keep yourself healthy. I mean, I have to be honest, I've learned so much about health and well-being in the last year. I always thought I was healthy. I mean, and I was for the most part, but I have definitely learned about what my body needs. And, I had no idea what my stomach did for me before losing it. So, I would say those are probably my primary support systems that I've gone through. Now that I've been out of chemo and that kind of stuff, I've kind of stepped away from some of the stomach cancer groups. But I pop in every once in a while to see what's going on with people and, help give feedback and any support that I can to other people. I'd have to say that probably has helped me a lot over the last 5-6 months, because that survivorship, I don't want to say guilt, but there is some of that happens when you've made it through the process, and there's still that worry. But, I think it's helped me to help do, the mentoring and talking to people and, sharing my story, I think has helped a lot to support my mental stability, actually, even after all this stuff. So I think that's all I have for my spot, but thanks for having me on and for sharing.
Thank you very much for sharing your story. Very interesting. Would you share a little bit about the genetic testing, because your case is a little unusual in that regard?
Yes, thank you. I'm so sorry, I forgot to say. So, okay, I do have the BRCA1 mutation. I do have a very low PD-L1. So it did give me the option to do the immunotherapy. So my cancer history is for breast cancer in my family. So my mom actually passed away at the age of 47 from breast cancer. Her mom actually passed away a year later from breast cancer. My grandmother on my dad's side also had breast cancer. And so last year would have been the year that I was supposed to start going for my early mammograms. Because I was 37, turning 38. And when he did the genetic testing, we found out that I did have the BRCA1s. So he is trying to get me on Lynparza for the mutations. So we're currently fighting with insurance on that right now. So, but yeah, so we found out that my tumor was caused from the mutation. So he's got me looking at different things for moving forward with trying to modify the mutation, I guess. So
great. Okay. Yeah. So thank you very much. Let's move to the next participant, Amanda Johnson, also a young patient. And her case is very interesting also because she has a hereditary type of cancer. She has a rare CDH1 genetic mutation, but I'll let her tell us about her journey and how she's doing now. Welcome, Amanda.
Thank you. So my name is Amanda, and I live on Long Island in New York, in a town called Sayville. I just want to thank you for the opportunity to be able to tell you my story. I was found to have a rare CDH1 gene mutation in November of 2017. My sister went in for genetic testing because my mother had had breast cancer and we were high risk. So they wanted to do some genetic testing, and they found out that she had the CDH1 mutation. So I tested after that. She went on to have biopsies where cancer was found and to have her stomach removed. My brother came later. He also is CDH1 positive. Our mother had died of breast cancer, and our maternal grandmother had stomach cancer, as well as many of her siblings. This hereditary mutation greatly increases one's chance of getting hereditary diffuse gastric cancer and lobular breast cancer, both very aggressive and usually not found until like stage 3 or 4. Currently, the common recommendation is to have a total gastrectomy, and that's the removal of the entire stomach. So there's no pouch, there's no anything left. In fact, on me, they had to go up higher because I had stomach cells up in my esophagus. And so they had to go even higher up to get all of those out. They just had to keep testing. And then possibly a bilateral mastectomy, which I had both of. And in the end, the cancer was actually found in both. Removal of the whole stomach can easily lead to other complications, which it did for me. Another option is monitoring through biopsies, but the waiting wasn't for me. It was going to be too much stress for me to just know that at some point it was going to come. So I just went ahead and ready to go through it. My biopsies, by the way, did not show any cancer. And it was recommended I go through the total gastrectomy as soon as possible. They currently are, when I had mine, they were recommending 30 to 50 biopsies every time one was done. They've just now increased that to the Bethesda method, where they take 80 to 100 biopsies because it is so difficult to find. And this way you have a better chance of getting it. Like for me, they didn't find anything in the biopsy. On December 22nd in 2017, I had open surgery to remove my whole stomach at Stony Brook University Hospital. I was the first person to have the surgery there. It's highly recommended to find a doctor that has a background in this. And I found a doctor at that hospital who had not done gastrectomies for CDH1, but had for other cancers and issues. And he had worked with a really high level doctor in New York City. And so I also wanted to stay close to home. So I found out, and there was no time to prepare because he wanted to do it right then because of my age and the facts of the family history. And so I really didn't, like I said, didn't have anything to prepare. And I figured if there was anything else that I needed to know, I'd just do it afterwards. That was a mistake. The trauma of losing one's stomach is pretty major. It's a whole body part that is important and one that other body parts rely on. Sure, it's possible to live without a stomach, and that's what they kept telling me, but it's really not easy. Once released from the hospital, you're left with trying to figure out how to function with this new body. What do I eat? What can I eat? How often do I eat? I eat every 2 hours, but I'm not feeling hungry, which I don't have any hunger. How do I fit drinking in? Because they can't be done while I'm eating. And then all the right supplements, because my body was not absorbing the proper vitamins and minerals. It was a lot to wrap my head around while being in a lot of pain. I also found it difficult to find a nutritionist who really understood what was going on. The best I found was a bariatric nutritionist. And that worked for a little while, but I really never did find find one, so it was kind of a hit or miss on what I did. But thankfully, the support that I had has been amazing. Now, I had special support because my sister and my brother both had the same surgery. So it brought us closer, and we were able to compare notes on what was working and what wasn't working. Not to say that we're all the same, very different. But that was very helpful. So thankful to the family, my family helping. Otherwise, I don't think I'd be able to take care of myself alone. There's also the support that Nicole was talking about with the Facebook group. There's one specifically for CDH1 mutation, and then all the other stomach cancer survivors, partial stomachs, groups that have been have been a lifesaver, really. The support and the love from those groups is amazing. And then the more you get into it, the more you start to be able to pay back and give the support and from your experiences. The other thing that was a good support for me was therapy. Like I said, there's a lot of complications, and so your mental state is really challenged. Everything from thinking too much about the what if, what is going to happen, what can happen, to anxiety and depression. I developed PTSD from all the surgeries that I had, and I now still can't go into the hospital without having anxiety attacks or just problems. It's really hard for me. The big complications I had after were, so I did have to have my bilateral mastectomy also. I've had to have my gallbladder removed. I've developed several kidney stones and some that had to be removed physically with stents placed in. I developed a hernia at the incision site from an infection. So I've had more surgery to repair the hernia, and now I've developed chronic pain from that. And that was 4 years ago. In the almost 5 years since I've had my stomach and breast removed, I've had 8 more surgeries and a lot of procedures, and I'm dealing with anemia and osteopenia. Each surgery makes me weaker and in pain. It really leaves one depleted, and you develop the feeling of hopelessness. This is where the therapist came in that really helped. She helped me with my anxiety and depression, and just trying to live for today and trying to stay positive. I highly recommend finding a therapist, especially in trauma, PTSD, or even body image before you have the surgery, because it's a lot to prepare for. I unfortunately didn't have the time to do any of that, and it was not good for me. The eating has also been very hard for me. Cooking was a passion of mine, and now it's just a medicine that I have to take every 2-3 hours. It's still difficult for me. I have my muscles don't work to push down the food, so I have to be very slow, chew a lot, and eat small amounts, and just be very, very mindful of what I'm doing. Nothing else can be going on. So my family's been really helpful with that, as far as making sure that I eat and drink when I need to, and just reminding me of things that I need to do, because I forget to eat. Like I said, I don't get hungry, so if I'm doing too much, I forget. I was working with little children beforehand, and quickly discovered that this wasn't going to help. This wasn't going to work. And I had spent years starting and developing a preschool that was outdoors. And I had to stop working, and it was really hard. So I had to go on disability for that. And it's been a long trip for that one. And again, all the support from that's been very helpful. I know there seem to be a lot of negatives in my recovery, but I just want you to know that there's no way I would have done anything else differently. The one thing that kept me going was my really strong desire to make sure I was alive for my son, my husband, the rest of the family, and my dear friends. I wanted to watch everyone's life unfold and see what they were going to be doing. I also had things in my life that I still wanted to do, and I wasn't going to let cancer stop me. It was hard, but trying to stay positive and away from the what if, like I said earlier, was almost 5 years ago, post TG. It's still hard. And now, sorry, my family is faced with another challenge of my sister's 2 young daughters that are about to be tested, and we're now waiting for results. The waiting is the worst. They have so much more to do with their lives, and we're going to make sure they have the best possible care. So it's now 2022, and I hope I'm done with surgery, but there's really no guarantee. For those of you facing this decision, I highly recommend doing the research and finding a doctor of excellence and putting together a team that will support you before, during, and after the surgery. As I said, it's possible to live without a stomach, but it's really not easy. Be prepared mentally and physically, and have a support system in place. My motto has become, having no stomach gives me more guts. And I really think that's true because I've had to advocate for myself and work hard to get where I am today. Thank you for letting me share my story.
Well, thank you very much for sharing your struggles and your advice. Hopefully this will help our patients in the audience. Let's then move to the last of the participants, Stephen Mellon. He was diagnosed with gastric cancer 14 years ago, so he's a cancer survivor, and I'll let him relate his experiences throughout this year.
Well, thank you for having me. Can you hear me? Everything okay?
Yes, we can.
Okay, great. So as you see, my name is Steve Mellon, and I've been a survivor, or some people call thriver, for the past 14 years. And our stories for all of the patients, there's different, but there's so many similarities. And if I think about the similarities between, Amanda and Nicole and myself, I was diagnosed at 37. They wanted the surgery. Well, I basically had the same kind of reflux and pain and discomfort that I slight loss of weight and multiple doctor visits prior to the diagnosis. I would, they thought it was stress because I was so young. They thought that, I had a lot going on in my life with a new baby and a new job and all sorts of things that were happening at that time. And they didn't jump immediately to stomach cancer. And so when I finally got to the point where the symptoms were building up and I was getting physically sick, like dry heaving or throwing up, I went to the emergency room one day because it was just too early to go see my primary care physician. And they did the full workup. They found out that I was anemic. Then they did a scan. Then they did an endoscopy, and they saw a mass. And next thing you know, they said you have stomach cancer. So there was a mass at my junction between my lower esophagus and my upper stomach. And I got 3 different opinions from 3 different hospitals. And I had to make a decision. That was really tough. I had about 2 weeks to figure this out. And I decided to go with Stanford because they were just a college that I always wanted to get into, but I could never get into the college. So I'm like, all right, I'm going to go to Stanford because I couldn't get into the college, so I'll get into the hospital. And it was kind of like just, I had to feel positive about where I was going and what I was doing. And their path was to, their protocol was to do the surgery, remove my stomach, and then do follow with chemo and radiation. And I did not know what I was going to get into. I had not done any research at all. I did meet one individual named JP Gallagher, who was 3 months ahead of me in this whole process, my same age and everything. So he was the only inspiration that I really had. We had the same doctor, we had the same procedure, all of it identical. So at least I had him to go to. We didn't have the Facebook groups, and I didn't have a lot of places to go to. So I have the surgery. I thought it went well, but I look back at my last 14 years and I feel like I've had every complication possible. Starting with the surgery, I sprung a leak and I ended up getting septic, and they sedated me and put me on a breathing tube for a week. I come out of that, I survived that. I spent a month in the hospital. Then I do my chemo and radiation. Radiation was really, really difficult for me. I was losing extreme amounts of weight. So I'm 6'1", and I was 170 pounds prior to this whole process. By the end of this, I was 95 pounds. So they had to hook me up to a PICC line and give me TPN nutrition just so I could maintain some weight, because below 100 pounds, I just have no energy. So those early days were very, very, very difficult for me. And you know, I was like, I don't know how much of this I can take, but I had this other person to follow, and as long as he was doing okay, I think I was going to do okay. So, you know, you fast forward, and then you go through the same things that everyone else has gone through, where you're building up your eating and trying to eat more. Your nutrition is just impossible, along with getting fluids in you, and along with just trying to work. And, you know, I was anemic. I ended up needing iron infusions later down the road. I've had esophageal problems where I've had to have my esophagus stretched 5 times because my esophagus has been constricting. And that they think is because of a Plummer-Vinson syndrome I had, which was because of the anemia and the esophageal web. So I acquired a pain medicine, an opiate addiction, which required me to go to rehab twice. All right, so I've had to do that. You know, anxiety, depression, you know, all those things. Divorce caused my marriage to fall apart. Like everything, everything was thrown at me. But then you get to that 5-year marker, which was huge for me, and I didn't have any subsequent recurrences. I was getting PET scans and CT scans every 3 to 6 months, and I was continuing to make progress. Every time I'd go in and get the results of those meetings, I would be crying after he'd give me the good news. I'd be like, I'm so happy, oh God. So I've been through it all. And so if I look at what I was able to get, I feel it allowed me to, my support group was my family, my friends, and a few other cancer patients that I knew, but I didn't have a huge group of people to go to that were inspirational. So when I see these groups and see people sharing their stories that have more time than me, it continues to give me hope. So that's why I think at this point in my life, I'm now more of a longer term inspiration about somewhere where patients can get to. But when you're in the beginning of it, in the middle of it, you're just trying to get through your day. You're just trying to get through your next hour. You're trying to get out of bed. You're trying to get fluid in you. And you're trying to hold things together. You're trying to work. I had to work, and I went on disability for a while, and I got into a huge financial hole, and you know, the pain I just kept on getting hit left and right by things. So then things start turning around, and I start to get better and better, and I ended up getting remarried to my high school sweetheart. And even to this day, you know, I still have complications that I'm dealing with. I had to have my gallbladder removed 3 years ago, right after I got married to my wife now. So I'm still putting my significant others through the stress of watching me go through these things. And that's what really gets me, is the people around me that I'm impacting. But I'll say, you know, I'm 52 now. At the age that I'm at right now, I'm as happy as I've ever been. And I feel like I can get through anything. And that's kind of what people tell me as well. They go, well, if anyone can get through it, you can. And we're stronger than we think. And I had one other complication. I had my intestines, I think, were impacted by the radiation from years ago. And I was getting a thing called intussusception, where my intestines were folding into themselves and they were blocking, and it was extreme pain. And I had it probably 3 or 4 times over the past 5 years. Well, it happened last year, and I ended up having to go to the hospital, and I had surgery to resect a portion of my intestine. That surgery was supposed to be 3 to 5 days. That lasted 3 weeks in the hospital. I was on a PICC line with nutrition. I didn't eat for 2 months until February of this year. And I had a wound pump because the wound was huge in my belly. It just, things didn't go smooth. So you keep on getting hit by things. But I mean, I literally bounced out of that. It took me about 3 or 4 months. But in the big picture, you know, giving up 3 or 4 months of being able to do things like you were, and scaring the hell out of, you know, your wife and kids and all that is, I've been given another lease on life, and I'm probably going to be living the longest of all my friends now, because I have all these parts. I've had my stomach, my spleen, my gallbladder, half of my pancreas, and a third of my esophagus all removed, followed with chemo and radiation. Oh, and 6 inches of my intestine taken out. But I will say I am more productive these days. I'm a mentor and a board member of Debbie's Dream Foundation. So I participate in support groups and help people individually all the time, and just try to give a little bit of hope, long-term hope for them. I did initially help start the Gastric Cancer Foundation with JP Gallagher. He passed away, which was a big blow to me many years ago, 11, 12 years ago. But I'm here, and I'm here to just to pass on the fact that I've made it. There have a light and focus out there that you can get to. I did write a book named Killer Graces that goes through, chronicles all these stories, but it's a happy ending because I'm still here. So if anyone has any questions, you know, feel free to always reach out to me. I'm very accessible, and that's my story.
Thank you very much for sharing your story. A few bumps in the road, more than a few, but you made it through, so we're happy.
Thank you.
Yeah, we have a few questions, if you don't mind. A few questions from the audience. The first question, my son was recently diagnosed with gastric cancer, and I think it would be a good idea for him to join a support group. How do you suggest I convince him?
Well, you have to want this. You really have to want it. And you have to be able to go to somewhere where you think you're going to have people that are similar to you that you can relate to. It's hard to hear a doctor tell you things, or a family member or someone else say you need to do this, because you kind of want to have control over your life somewhat. And in this case, now what I would do is I would go to the support groups. I like Debbie's Dream Foundation because they at least give you a lot of different avenues to work with individuals that can match you up with someone who might be similar to you, and you can kind of ask them questions, and it'll give you a little hope. But if you want to just go to like a stomach cancer warriors and caregivers, that on Facebook is a resource where you could scroll through and look at what's going on and what people are posting. The thing that I have a difficulty about some of these support groups is there's a lot of negative stories out there. People are telling the stories of where you hear a lot of bad, and it gets depressing. So I think you need to find someone where you want to emulate and you want to get to where they're at. And that's through mentorship in whatever way you can get. And so, you know, although it's hard to talk to these people because you're afraid, it's good for both people. It's good for the people mentoring because it gives them a sense of purpose in their life and it helps them move on. And it's good for the people that want to get to where they're at. So it's a win-win if you can get to something like that.
I would agree with Steve, depending on his age group and, if he's on Facebook quite a bit, it was probably a great starting point for him. I mean, that's where I came upon Debbie's Dream Foundation, myself, nobody sent me there. But, I had a relative that suggested, hey, check out some of these groups, some of these support groups, don't Google, no Dr. Google. That was like one of the biggest things is stay off Google. But, I joined up with a few of the different ones and I found there's one primary one that I'm really, really into with some of the individuals. But I agree, Steve. I think you have to look at the people that you want to emulate. You want to get to that point. You want to stay positive. And that's part of the reason I've kind of stepped away from some of them. Like I don't follow all of them all that much anymore, just because I need to focus on me and I need to focus on me getting better and me being okay with having been sick and making it to this point, because not everybody does. I mean, I was a stage 3 and luckily I found it early enough, but I agree wholeheartedly with you. You can't push somebody to do it, but I think you need to. Mentors are great. People that have been through it, know what you're going through, understand. It's great to have somebody to share your problems with. I mean, even the positives, not even just your problems.
Yeah, it's definitely the positives also, because you can you want to celebrate those, and you have somebody you can celebrate with. That's one of the reasons that I like the particular group I'm in. However, it's just for CDH1 patients. But if he finds a group that fits his needs, you can even, maybe somebody in there he connects with, and then that would be that one person that he could do like a buddy system with, and they can contact outside of the Facebook group. Or a lot of organizations actually have a mentorship set up, so you can just fill out a form and they'll find a mentor for you, and you can do that too. But I didn't realize how much support I needed. I didn't find the support until I was in the hospital after my surgery, and it made a huge difference on my healing and just accepting it. Definitely important.
All right, great. Thank you. We have another question. My dad was diagnosed with cancer last month. He and my mom live in another state, and I cannot be there to help them on a daily basis. What can I do to support them from far away?
Nicole, Amanda?
What? You call me?
Yeah, I'm calling you too, because I didn't have any support from a distance. It was all close.
One thing that we have a really close family and a large family and a large group of family friends. I found something helpful for them and for me also was, and I can't remember the name of the website, but it was Helping Hands or something like that. And it wasn't like the GoFundMe or anything like that. It was specifically for patients, and you could give updates and it went to everybody. You could also set up, if people wanted to send you gift cards, or if there were local people and they wanted to come and do stuff. But it was kind of an all-in-one. And I found that helpful because it was easy for me to focus on just sending quick updates and not having to go all over the place. And for them to also contact me. Just Helping Hands or Loving Helping Hands or something like that.
I will say that people were afraid to talk. Oh, sorry, man, or Nicole.
No, go ahead.
I was just going to say that people became afraid to talk to me. So that's what I noticed, is that I think that but not being afraid to reach out and at least communicate in once in a while and just say you're there for them if you need anything. But some people, like, they come over and they wouldn't know what to say. They would be afraid, or they would completely ignore me. And it was an interesting time to see who stepped up and who didn't. And I look back and I go, you know what? I really, really appreciate the people who maybe they sent me a card and just, I'm thinking about you, or maybe they just called me. And but there's some people that I thought were really close that they just could not even deal with it because it scared them too much.
I was just going to say, I had a family member from afar. She used to send me Ensures. So she got me on a program where it would come on a monthly basis back when I could drink the Ensures. Now they have too much sugar in them. But, you know, when I was trying to gain weight back because I lost so much going into my surgery, you know, she had me on an automatic thing where she was sending me that. You know, I did have family members as well that were sending me cards on, you know, whether or not it be a weekly or monthly basis, you know, shooting over text messages, you know, just the connection and, you know, letting them know that you're thinking about them, you know, and asking even the question of what do they need, you know, and knowing that you are far away, you know, asking what can I do for you, you know, because there maybe is something that you're not thinking about that they need from you. So
Great, thank you. Let's go to another question. How do you keep a positive perspective on life with a life-changing diagnosis?
Can I share on mine? I'm somebody that likes to stay busy, but I'll tell you, it was crushing. You know, I was sick for a good couple of months before actually getting my diagnosis. And when they told me it was cancer, actually, so the situation for mine was, as I went to my GI, he did not tell me, very similar to one of the other gentlemen this morning, he didn't tell me right away that he knew it was cancer. But I'll tell you, my oncologist knew from the moment that he saw the scans and the pictures. We didn't even have my pathology back, and he knew. And my GI guy had set me up with my oncologist and my surgeon prior to even having the pathology back. So when I got the first phone call, I broke down. I had a panic attack, like literally to the point where, you know, I mean, I was already having a hard time eating. I thought I was going to have to call an ambulance to come and take care of me because I panicked that badly. Luckily I had a friend that lives close and I was able to get a hold of her, and she came over and stayed with me while I did that. But I would say the people around you, the support systems that you have, I did a lot of sharing on Facebook. So, you know, with my age group, I kind of, maybe it was my documenting on my own way, in my own way, but I was sharing things on Facebook, and I'll tell you, the positive comments that people would make, or, you know, just people reaching out and that kind of thing, staying busy for me too. Like, yeah, during my chemo weeks, I knew I couldn't do a lot of stuff, but reaching out to friends, you know, talking to friends, talking to family members, days that you're feeling crappy, taking the time to yourself, making sure that you are number one. You know, honestly, that is probably the biggest thing, is focusing inward on yourself, and understanding what you need. I think for me was the hardest thing, but it kept me positive in the aspect that, you know, okay, I knew if I needed to sleep, I needed to sleep. And if I didn't feel like eating, it was okay that I wasn't going to eat. You know, on the good days, on the days that I'm feeling amazing, like I can run a marathon, I'm going to eat. I'm going to eat whatever I can, whatever I want to, and I'm going to feel good about it. You know, on the days that I'm feeling good, you know, and it was a struggle for me because we were during COVID. And so I had to keep distance, and I got COVID in January while I was going through the last part of my radiation treatment, which was just insane. But I think really surrounding yourself with positive people, and whether or not that is a phone call, being on Facebook, sharing your story and having people comment great things about you or whatever, you know, it's going to be hard. I'm not going to lie.
Yeah.
It is going to be really, really hard. It is a change of life. It is a completely new lifestyle, but
I can tell
talk to
you what
somebody
not
that
to
knows.
do.
Yeah.
You know? Yeah, I can tell you what not to do. It's what I did, right? So and this is a great question, because the anxiety and the fear, the depression, all this stuff is huge and thrown on you. And I don't handle those things very well. I don't know who handles this kind of thing because it's extreme, but I medicated and medicated more than I should have because I didn't want to deal with it. Now, Ativan was one thing they gave me, but there's a whole list of things of pain meds and everything I took. So much so that over the first year and a half, it got to be really, really, really bad. I mean, I was taking way too many, Oxycontins and stuff because I wanted to numb out. I didn't want to deal with the pain of everything I was dealing with and what I was putting everyone else through. I just felt that. So I really, really started to improve when I got off all the medication. I was taking 20 Oxycontins a day, 20 20s a day. And I was able to, when I got off that, I gained 25 pounds right away. And so I gained weight, I felt better, I got clearer, and I fought it like with a clear head, but I just basically numbed out. And so don't do that, because I had to go to rehab twice too, and that's not fun either.
Great, thank you. I guess we have time for one last question. What advice would you give if you are undergoing cancer treatment and still having to work?
I didn't do that, so you can.
I had to work, and I minimized my time showing up. I thought that it wasn't going to be as big a deal at first, because I was told that I was going to be a week in the surgery, I'd be out, and then I would be able to, slowly get back to my office job. It was nothing that easy. Everything was harder than I anticipated. So I stopped going into my office. I was kind of working remotely because I was able to do that to a portion, but they started calling me saying, are you coming back in? And I was unable to do it. And so I had to go on disability. Unfortunately, the disability didn't nearly cover what I was doing. So it put me into a huge financial hole. And it increased my stress, anxiety, and pressures after that. So, that's a big thing that people need to figure out is how can you maximize your health benefits, your disability that you have, and take advantage of it when you can, because if you can get something that can at least get you by, although it's good to engage with the world and society to help recover, so I tried to do it too quick, and I would go into the office and I would be like, I was a shell, and I shouldn't have even been in the office. It was just too soon. So, let your body recover some, but push yourself also. You got to push yourself a little bit. You can't just, sit and pop pills all the time like I was doing. You gotta stop that behavior, get out, move your body, and just, it takes time. That's the one thing that it's not immediate. It's just going to take time.
Great. Thank you very much. I think it's very helpful to hear your experiences, all the difficulties that you went through, and most of all, how you overcome all the adversity and basically are on the road to a normal life or close.
Yeah.
So I want to thank you again, and this will conclude this portion of the symposium. I think that I will allow now Andrea Edelman to give some final remarks.
Thank you, Dr. Ucar. I would like to thank each and every one of you for taking part in our 2022 DDF and Miami Cancer Institute Virtual Stomach Cancer Educational Symposium. It's been quite a day listening to the wonderful speakers and our patient panelists. At this time, I would like to take a moment and thank once again our wonderful chair, Dr. Antonio Ucar, for his leadership, and all the doctors at Miami Cancer Institute and the wonderful staff and the wonderful DDF staff as well for helping and participating and making this event a huge success. Dr. Ucar, please accept this token of appreciation from the Debbie's Dream Foundation for all your hard work.
Thank you. Thank you very much. It's been a pleasure participating. It's been, I think, a great event for our patients, and I think we covered.
Thank you again for attending this symposium. And if you would like to learn more about Debbie's Dream Foundation and any of our upcoming events, please visit www.debbiesdream.org. Thank you.
Thank you very much. And finally, we thank you all for joining today. Thank you to David Stream for partnering with us to bring you this comprehensive symposium today, and to our speakers for providing exceptional presentations. Our hope is to continue seeing you in one of our many virtual educational programs to help you stay connected to our Miami Cancer Institute family. We're here to serve you and offer you better cancer care. Thank you very much.